This is a video on all 16 types of contraception, including sterilization. The external condom is made out of a thin latex. Non-latex condoms are also available. It's pinched at the tip, then rolled over the penis to stop sperm entering into the vagina. It's 98% effective when used correctly. It can be easy and effective, relatively cheap, or can even be given free at sexual health clinics. It protects both people against STIs, and there's no advanced prep needed. Cons are that it can rip, break, or tear, it can ruin the mood, and it has to be taken off immediately after ejaculation. There are no side effects. The internal condom is made of a thin polyethylene that loosely lines the vagina and stops sperm from entering. It's 95% effective if used according to the instruction, but 79% effective for the average person with a vagina. It protects both people against STIs, and it doesn't need advanced prep, but it can be put in up to 8 hours before if necessary. It's less commonly used and sold, it can get pushed into the vagina, and it can rip, break, or tear. There are no side effects. The intrauterine device is a long-acting reversible contraception, LARC. It's a small plastic and copper device known as the coil. It's put into the uterus by a doctor or nurse. It does not depend on you taking it daily. It works immediately and can stay in from 5 to 10 years. The intrauterine system is a small plastic device that's inserted into the uterus by a health professional and slowly releases the hormone progesterone into the womb. It doesn't contain hormones. Fertility goes back to normal after it's taken out. It immediately protects you from pregnancy, and it can be used as an emergency contraceptive. It can work for 5 years, but it can be taken out sooner. It can make periods lighter, shorter, and therefore less painful. The hormones are localized and only small amounts enter your body. It's a good option for those that can't use estrogen. It causes potentially heavier, more painful, and longer periods. There's a small risk of the IUD being pushed out or displaced. There is a small chance of getting an infection in the first 20 days. It can cause irregular periods and spotting for up to 3 months after insertion. The side effects are heavier, more painful, longer periods, stomach cramping, headaches, nausea, mood changes, breast tenderness, back pain, and acne. The combined pill is a daily oral contraceptive that contains estrogen and progesterone and is over 99% effective if used according to instructions, but 91% effective for the average woman. It's easy to take and stop taking. It can make periods lighter or more regular, and it helps with PMS and acne. It doesn't interrupt sex. There are no long-term effects to fertility. Forgetting to take your pills, vomiting, or bad diarrhea can make it less effective. It can cause temporary side effects. You have to remember to take it daily. Headaches, mood swings, nausea, tender breasts, and blood spotting when you first start. Long-term/more serious, it can cause blood clots, breast and cervical cancer. The progesterone-only pill is a daily oral contraceptive that contains the hormone progesterone and is over 99% effective if used according to instructions, but 91% effective for the average woman. It's easy to take and stop taking. It can make periods lighter and less painful or stop them altogether. There are no long-term effects to fertility. It doesn't interrupt sex. It's good for those that can't have estrogen. Forgetting to take your pills, vomiting, or bad diarrhea can make it less effective. It can cause temporary side effects. It needs to be taken daily at exactly the same time. Not effective if taken over 3 or 12 hours late, depending which one you take. It may cause irregular periods. The side effects are headaches, mood swings, nausea, tender breasts, and blood spotting when you first start. The diaphragm is a soft dome made of latex or silicone and is used with spermicide. The contraceptive cap is similar to the diaphragm, though it is generally always made out of silicone. It is put into the vagina to cover the cervix and is 92 to 96% effective when used correctly. It can be put in a few hours before having sex. You only use it during sex. There are no serious health risks. It doesn't disturb your menstrual cycle or interrupt sex. It's reusable. You have to leave it in for at least 6 hours after. It needs to be inserted every time you have sex. It must be fitted by a doctor on the first time. You have to add extra spermicide if you have sex more than 3 hours before putting it in. You can't use it on your period. It can take time to learn how to use correctly. You need to use spermicide with it. There are no side effects unless you're allergic to latex or silicone. The contraceptive injection is a long-acting, reversible contraception that does not depend on you taking it daily and is more than 99% effective. It works by a doctor or nurse injecting progesterone into the body. It can be used if you are breastfeeding. It doesn't interrupt sex. You don't have to think about your contraception once it's been inserted. It can reduce painful periods. It offers some protection from pelvic inflammatory diseases. It can't be removed from the body once it's been injected. It can cause some women to gain weight. If you hate injections, this isn't for you. Injection can be painful, bone thinning, but this usually recovers once the injection stops irregular periods and weight gain. The contraceptive implant is a small, flexible rod that is placed under the skin of the upper arm by a health professional. It releases progesterone to stop ovulation. It's a long-acting reversible contraception that does not depend on you taking it daily and is over 99% effective. It lasts for 3 years. You don't have to think about your contraception once it's been inserted. You put it in using local anesthetic. It can be taken out earlier than 3 years if requested. It doesn't interrupt sex, and it's an option for those that can't have estrogen. It may increase your chances of getting acne. You can feel it with your fingers in your arm, although it can't usually be seen. You put it in using local anesthetic. You may have similar side effects to the pill. Periods may be irregular or stop completely. Headaches, mood swings, nausea, tender breasts, and blood spotting when first inserted. The contraceptive patch is a small patch you stick on the skin that releases estrogen and progesterone. It stops ovulation and is over 99% effective if used according to instructions. You don't have to think about it every day. It can make periods lighter and more regular. It can improve acne and reduce PMS for some women. It doesn't interrupt sex. It has a low risk of serious side effects. It can cause temporary side effects. It may cause skin irritation. It's visible, unlike other contraceptives. Headaches, mood swings, nausea, tender breasts, and blood spotting when you first start. The long-term, more serious side effects are blood clots, breast and cervical cancer. The contraceptive vaginal ring is a small plastic ring a woman inserts into her vagina every month. It releases hormones to stop ovulation. It's over 99% effective if used according to instructions. It's used for 3 weeks out of 4. You don't have to think about it for 21 days. It can make periods lighter or more regular and reduce pains. You can insert and remove it yourself wherever. It's easy to insert. It has a low risk of serious side effects. It can cause temporary side effects. You must be comfortable inserting and removing it yourself. It has similar side effects to other hormonal contraception. It may cause vaginal irritation and discharge, headaches, mood swings, nausea, tender breasts, and blood spotting when you first start. The long-term, more serious side effects are blood clots, breast and cervical cancer. Natural family planning, also known as fertility awareness, relies on you knowing the fertile and infertile times of your menstrual cycle by noting different indicators to show when you can have sex without the risk of pregnancy. It's up to 99% effective when used correctly, but 75% effective if you make mistakes. The NHS recommends speaking to a trained fertility awareness professional. Hormone-free and requires no device or pill. It can give you greater awareness over your body. It can be used to plan a pregnancy as well as prevent. It doesn't interrupt sex. It takes 3 to 6 menstrual cycles to learn it. You need to take daily records of your body temperature, cervical mucus, etc. It takes commitment, and if you get ill, it can make results harder to interpret. It can be difficult if you have an irregular menstrual cycle. The side effects are none. The emergency contraceptive pill, LNG, can be taken within 96 hours for days of unprotected sex. However, it is most effective within the first 72 hours, 3 days, of unprotected sex. Because of this, some services may only offer LNG up to 72 hours after unprotected sex. The emergency contraceptive pill, UPA, can be taken within 120 hours, 5 days, of unprotected sex. There's no limit to the number of times you can take it. It stops you being pregnant. It's readily available from most pharmacies. It's 95% effective if taken within the first 12 hours of the unprotected sex. Effectiveness decreases the longer you leave it. It can make your period come earlier or later than usual. Some medicines can reduce its effectiveness. It can cause some temporary side effects. If you vomit within 2 hours of taking it, you must go to a professional and receive another. Different types of emergency contraceptive can't be taken during the same menstrual cycle. Feeling a bit sick, dizzy, or tired after taking it, headaches, breast tenderness, abdominal pains, vomiting, only a small number of women, and irregular bleeding patterns. Female sterilization is a permanent method for women who are sure they will never want children. It works by cutting or sealing the fallopian tubes in an operation. You never have to think about contraception again. It's usually performed under general anesthetic. It's permanent. Periods will not be affected. It can't easily be reversed. You may experience some discomfort post-operation. You need to be 100% sure, and counseling is needed beforehand. It's uncommon, but tubes can rejoin by themselves. Periods will not be affected. The side effects are none. Male sterilization is a permanent method for men who are sure they will never want children. The tubes that carry sperm from the testicles to the man's penis are cut, sealed, or tied. You never have to think about contraception again. It's usually performed under general anesthetic. It's permanent. It can't easily be reversed. You may experience some discomfort post-operation. You need to be 100% sure, and counseling is needed beforehand. It's uncommon, but tubes can rejoin by themselves. The side effects are none. The intrauterine device